Hola, doctor.
Hola, doctora, ¿cómo está?
Muy bien. And that is the extent of my Spanish. So let's not pretend I can speak Spanish or that we will conduct this interview in Spanish.
It's a
How
good
are you?
start. Doing great, finally relaxing.
I see it. Actually, that's a good place to start. It's meant. I know that you burn the candle at both ends. So, a lot of us are very busy during the pandemic, but you have a busy practice. You're also doing outreach. You're doing research. And I'm glad to see you relaxing. So how have you been taking care of yourself during the pandemic?
It's very hard, Dr. Lisa. It's very hard to try to take care of myself. I'm more of do as I say, not as I do. But what I try to do is get home as fast as I can so I can enjoy a little family time and relax for at least 2 hours. And then unfortunately, because of all the stuff that we have to do for the COVID research that we're doing and all the other activities that I have to do, I have to pick up the laptop and continue working for at least another 4 hours from home. So it's hard.
Yeah, but it's not sustainable. So we have to take care of ourselves. So make sure you make a plan. So as you said, do as I say, not as I do. I say, physician, heal thyself.
Yes, ma'am. I have to start doing that just right now, which is why summer's a good time to start, right? The summer's a good time because you want to be outside doing fun stuff. So it's going to allow us, and I think it's going to help a lot of people with COVID as well, with this COVID crisis, to get out, here where I am, people playing baseball, having a nice time, and they're relaxing. And that's what we need to do is relax and let our hearts kind of relax a little bit, let our minds kind of open up.
Yeah, and I think it's a good opportunity to remind people that being outside is actually the best place to be during this pandemic. Even before we had vaccines, being outside, you're much less likely to transmit coronavirus, even if you're unvaccinated. So I'm glad to see you outside. Stand without your mask even. That's great, right?
Yes, it's so nice not to have a mask on, but even when we're out, we always try to make sure that we just keep the distance, and people need to listen to that, and people do it. And now that it's summer, they're going to start doing it, hopefully listening a little bit more to these guidelines.
Yeah, well, I wanted to have you on here because, as you know, Black and Hispanic populations have actually been really hit hard by the pandemic. And I know there are still some challenges with getting people in the Hispanic community access to vaccinations or even information. So what are you seeing and what concerns you?
So what concerns me is the lack of good information and the increase of the gossip of all the bad information. Starting with something as simple as if you're undocumented, you really shouldn't do it because they're going to get you then, right? They don't know what the side effects are, which is a legitimate concern. But it's also wanting to do it, but being concerned or listening to others. And that's probably the hardest thing is, like I said before, is just this gossip rumor mill that's happening that is keeping people from getting vaccinated because they're expecting bad side effects. And there aren't any side effects to date.
What did you say? There are or are not?
There are not a lot of side effects that people need to be concerned with. The side effects are very known by now. Yes, we did have a few scare cases with very bad situations in some of these female patients, but that happens with medications all the time. And I try to tell it to people, these errors happen all the time, or these side effects we can find in everything. But since coronavirus is what we're really focused on, all of this stuff is coming to light now. But I can give you information on Advil giving people problems and giving issues with their liver and stomach. So there is problem out there with other medications.
Yeah, well, and even the vaccines, sure, side effects, everyone has different side effects. I had what I thought were pretty bad side effects when I got my vaccination, and I was really tired and achy for a couple of days. But you're right, these vaccines for the most part are safe. I know there's a lot of misinformation, as you said, about the vaccines, but as someone who is experienced in research and clinical trials, which are how we tested these vaccines, what do you say to people who say the vaccines, they don't trust the vaccines because they were produced too quickly or they rushed the process?
I tell them that in this particular case, since this is this pandemic situation, all these pharma companies got together and have decided to put their resources together and combine the results to share information because it is one common mission, which is to save lives. So this is not a mission of making money. It's a mission of helping the world. And because of that, we've been able to identify results faster, get more information, and collaborate and have other companies help make the product faster.
Yeah, and I also remind people that, usually, how long does it take you to enroll enough people in your research studies, Dr. Fabian? It takes a while, right?
Oh my gosh, yes, it takes a year even to just get 25 patients.
Yeah, but in this situation, because we're in a global pandemic, we had people volunteering and we had more people than we needed for the studies in record time. And so that cut off a lot of the time as well. So there are lots of reasons, including all of the administrative hassles associated. How long does it take you to get a protocol or approval to do a research study?
Oh my gosh, it could take 6 months to a year.
Yeah.
Just to get the approval process done.
Yeah, exactly. So I think it's important to talk to people about that, particularly because you have so much experience conducting research before we had a pandemic. So you know what the process was like before, and now you understand why things went so quickly. And it's a good thing because now we have vaccines.
Yes, and I tell people all the time, it's okay that it took this short amount of time, but remember, it was still under an emergency use authorization. Now, after almost a year, while during this emergency use authorization that we're going through, it's coming to be finally fully stamped as approved, right? So that's what I remind people as well. But it had that approval because we knew the results were positive. And that, Dr. Lisa, is probably the most important part, is that we have continued to educate our patients about why it's happening and why it's okay to get vaccinated and why it got approved so fast.
But can you help people understand the difference between an emergency use authorization and FDA approval? Because a lot of people are saying, these vaccines aren't approved by the FDA, but that's actually not true, right? So can you help people understand the difference?
So the emergency use authorization is put in play once we've seen that there's other phases of the vaccine or whatever medication that we're doing that has shown positive results, that the efficacy is a good efficacy point.
What's efficacy?
Oh, efficacy means that it's effective and reliable and to the point, as opposed to a scattered kind of result. It's actually doing and saying it's doing what it's supposed to be doing, right? So it's showing that it's working, that the results are positive in more people than expected. Because of that, they can then go and apply and be allowed to receive this. So, when we were in the whole anthrax scare, we also had an emergency use authorization for some medication for anthrax, right? And we had those on hold just in case of a situation, a larger emergency. And then once that happens, eventually you're going to have what's known as the full FDA approval, which has to have review committees that take care of this. And these are independent review committees, not associated with the pharmaceutical companies. They're independent, that they look at the lab, at the safety results and say, yes, it's good, medications can get approved. And in this case, yes, this vaccine can be approved. And that's where we are right now with some of these vaccines coming out.
Yeah. So I want to just touch on one other thing you said, and that is people who might be undocumented are concerned if they get vaccinated, they might be in trouble with the government. Can you just reassure people and help them understand that?
So anytime you go see any healthcare provider or receive a vaccine in this case, they never will ask you for your documentation paperwork. That's not what health is about. Health is about saving someone and saving their lives. So we never will ask that. And medical locations are considered safe havens in a lot of states where they can receive care without having that concern. So don't ever worry about immigration coming to look at or grab you while you are actually in a healthcare system.
And also the vaccines are free. So even if people ask you for your insurance card and you don't have insurance, it's okay. They are just trying to document this information, but you can still access the vaccine without insurance, right, Dr. Fabian?
Yes, ma'am. Dr. Lisa, you're exactly right. There is no need for insurance to get this vaccine.
Because the government, that's another reason it happened so quickly, because the government said to the pharmaceutical companies, we will pay for the vaccines. So the government's already paid the bill for everyone to get vaccinated.
Right, and that's probably the best part. We don't have to worry about going somewhere to get this and getting a bunch of paperwork to show up, put your arm, get vaccinated, and continue a safe and happy life.
Yeah, I also just have I would love to get your opinion or your advice for employers of people who might be undocumented. There was a story recently about 2 undocumented workers who went to get the vaccine, and then they were reported by their employer and fired. This was in the newspaper. So what's your reaction to that, or your advice to employers?
I mean, it's terrible. If that happens, that's someone that doesn't care for their staff. That's someone that doesn't see the value in good employees, good individuals that are taking care of their staff. So because
Sounds
of that,
like you're somewhere
I think it's
fun.
very
What's
unfair.
happening
It is. There's kids are doing their graduation, summer parties, so it's a nice day.
Yeah, I'm sorry to interrupt you.
Employers,
I just heard all the
employers
excitement,
really shouldn't
so
be.
I had to know what that was.
It's a beautiful day. You should see all these kids dressed up.
Yeah.
But employers shouldn't do that. I mean, we put trust in our employers, and employees, put this trust in us. So it has to go both ways, and it's unfortunate they would have to do that. I mean, that's pretty sad that they went to that extent.
Yeah. Well, Dr. Fabian, I don't want to further encroach on your relaxation time, and I know it's much deserved. So why don't you tell people where they can find you on Tu Salud, Tu Familia? Or did I get that right?
Absolutely. Yes, ma'am.
Okay.
So Tu Salud, Tu Familia, which is your health, your family, every Saturday morning on Telemundo, Washington, D.C. At 11:30 a.m. or our Facebook, Tu Salud, Tu Familia, or our website, tusaludtufamilia.com, or on YouTube. So you can find all of our videos there. We have done 80 shows. 18 of those 80 shows have been on COVID. So pretty much every question you've had on COVID, I have answered on the TV show. So it's a great opportunity, and please take it and share it with everyone, because if we keep this program to ourselves, it doesn't work. The point of the show, and the reason why we put it out on social media, is so that everyone can grab it and share it for free.
Outstanding. Dr. Fabian Sandoval, one of the Grapevine Health Speaker Bureau team members. So thank you so much for being here, and go and enjoy yourself.
Thank you, Dr. Lisa. It's so nice to let you to allow you. Let me say it again. It's so nice how relaxed I am that you, Dr. Lisa, have allowed me to speak to you about this important topic to everyone. And it's thanks to the leadership that you have provided the community that people are becoming healthier. So thank you, Dr. Lisa, for everything that you do.
All right. Well, we'll see you on the street.
Yes, ma'am. Bye.
Bye-bye.